Hi, my name is Alexa, and today I'll be performing deep tendon reflex assessment. So before I begin, I'll perform hand hygiene, provide patient privacy closing curtain or door. I'll then introduce myself to the patient. I'll verify patient's information, and I'll explain procedure or assessment, So for deep tendon reflex assessment, I'll be using this hammer, and then I'll tap 4 different areas of your body, which will be your bicep, tricep, patellar, and Achilles tendon, which will stimulate a response, and we will assess it. So this assessment can be done on anyone, but it is important to do it on pregnant patients because it indicates any related complications such as preeclampsia. So for example, if I were to tap on my patient's patellar tendon on a pregnant patient and it is hyperreflexive along with signs and symptoms, it indicates preeclampsia. So this procedure measures the motor system and condition of upper and lower neurons. So this is graded on a 0 to 4 scale, 0 being absent, 1 being hypoactive, 2 being normal, 3 being hyperactive, and 4 being burst with clonus. So for this procedure, it is done bilaterally. So bilaterally to assess symmetry. So I will be only doing on one side for this video. So I'm going to start off with the bicep tendon. So for the bicep tendon, I'm going to grab the patient's arm and we're going to make sure it is well flexed, and we're going to follow along the bicep tendon. I'm going to place my arm under their elbow to make sure it is well relaxed and flexed. And then I'm going to put my thumb on top of the bicep tendon. And then now like that, I'm going to grab my hammer and I'm going to tap with the pointy side so we can see a response. There you go, as you guys can see. Now moving on to the next, we're doing the tricep tendon. So I'm going to grab my patient's arm. We're going to put it like this, and this arm is going to secure right here, making sure it's relaxed. So like this, we're going to look for the elbow, and then just above that, we're going to tap. So using the pointy side of my hammer. So I'm going to tap. As you guys can see, there is a response. I'm going to let that go. So moving on to my patellar tendon, we're going to make sure our leg is dangling and relaxed. And then right below, we're going to look at the kneecap, and right below that, there's an indentation right there. And that's where we're going to tap with our hammer. So this time our hammer is going to be flat, just the long side, not the pointy, but the long. I'm going to tap right here, and then we're going to see a flex. As you guys can see, there is a flex. So, and there is a reaction. So now we're going to do the Achilles tendon. So for that, I'm going to grab my patient's leg. I'm going to put my hand right here, and I'm going to dorsiflex just like that. So the Achilles tendon is back here. And then the response it'll give us is a plantar flex, which our feet will go straight down like that. I'll go straight just like that once I tap it. So we're going to do the long side too, not the pointy, but the other side. So we're going to tap. As you guys can see, it did give me a response. So now that is done, we're going to assess for clonus. So it is going to be the same thing. Our feet is going to be straight and relaxed, and it is dangling. I'm going to grab my patient's feet. I'm going to put my hand here, and we're going to dorsiflex. So for this one, we're going to assess after I drop it. So I'm going to drop my patient's feet. As you guys can see, it goes straight down just like that. So that is a normal response, which is for negative clonus. But if my patient's feet were to, if I dorsiflex it and my patient's feet were to shake 3 times like this, going down 3 to 4, that is a abnormal response. So it will be positive for clonus. So now that my patient, now that I'm done with my assessment, I'm gonna get my patient comfortable, colli within reach, side table within reach, and then I'm gonna perform hand hygiene, and I'm done. Thank you.